Many varieties of bacteria are present in the different regions of the mouth, such as the cheek regions, the gums, and between the teeth. When we eat food, these bacteria survive on the food that is stuck between the teeth. As a result, they release toxic materials that affect the mouth, leading to bleeding of gums and loosening of the teeth. In some cases, the complications that are caused within the body are also seen as symptoms in the mouth, which shows bleeding of the gums and ulcers in the mouth. You must observe such abnormalities in the oral cavity and report the same to the nurse or the doctor. Brushing the teeth and rinsing the mouth are the most common activities carried out to maintain oral hygiene as a daily habit. Maintaining oral hygiene will depend on the condition and type of food the patient eats. If the patient is eating normal solid food, then encourage the patient to brush the teeth every day. Ensure that the required equipment such as toothbrush, toothpaste, and other such material are kept ready for the patient to use. Teach the patient the correct method to brush teeth. The patient must use soft circular motion while brushing the teeth. Some patients use false teeth called dentures for chewing food. It is your duty to help the patient in cleaning the dentures on a regular basis. You may clean them under running water or use a soft brush. After brushing the teeth, encourage and assist the patient in rinsing the mouth with water or a mouthwash. If the patient is not consuming solid food but is being fed with the help of a drip, then ensure that the oral cavity is clean. Some of the signs of bad oral hygiene include bad smell from the oral cavity or bleeding. If you observe these symptoms, then immediately report the same to the nurse or a doctor and take instructions for further action. Equipment used for maintenance of oral hygiene. Oral hygiene is maintained using a toothbrush, toothpaste, mouthwash, and dental floss. A toothbrush is a simple bristled tool that is used to remove the food particles present between the teeth and to keep the tooth surfaces clean. The toothbrush is a hard structure that can injure the mouth. So, a toothpaste is used to smoothen the action of the toothbrush. It also kills some of the bacteria. Some bacteria cannot be removed by brushing the teeth alone. So, we use a mouthwash. A mouthwash is a dilute chemical substance mixed with water. It is used for rinsing the mouth after mixing it with equal quantities of water. A dental floss is a thread-like structure that is used to remove food particles stuck between the teeth. You should keep the required equipment ready for the patient's use as and when requested by the patient. You must also encourage the patients to brush their teeth regularly. General precautions to be followed. Speak in a gentle, soft and soothing voice when helping patients brush and floss. Avoid brushing the tongue as this can cause irritation in elderly patients. Instead, use a tongue scraper to clean the tongue. The toothbrush handle becomes easier to grip and hold if you wrap the handle of the brush with a tape. Teach patients and caregivers to brush the eating surfaces using soft, circular motions. Instruct patients and caregivers to replace toothbrushes every 3 months. Keep all toothbrushes out of the hands of others to avoid sharing germs. If the patient is using a denture, remove the dentures. Clean them gently under running water or by brushing with a soft brush. The various abnormalities that can be observed in the oral cavity include redness of the skin, bleeding of the gums, or bad breath. Report these abnormalities to the nurse or a doctor immediately.